Hello, my name is Brittany Corey. This presentation is on alcohol use disorder, its prevalence, risk, and treatment strategies. Alcohol use disorder is a chronic disease characterized by compulsive alcohol use, loss of control over intake, and negative emotional states. It's one of the most prevalent substance use disorders, leading to significant health and societal consequences. Although it is legal to drink alcohol for those over 21, its widespread acceptance in American culture often overshadows the dangers it poses. This presentation will discuss the prevalence of alcohol use disorder, its risk factors, impact on health, diagnostic methods, and the most effective treatment strategies.
Understanding alcohol. So, alcohol is one of the most commonly consumed substances worldwide. It is classified as a depressant, meaning that it slows down brain function and central nervous system activity. Different alcoholic beverages vary in alcohol content, but a standard drink is used to measure alcohol intake. Despite its legal status, alcohol remains one of the most widely abused substances, contributing to serious health and social consequences. Despite its dangers, alcohol remains one of the most socially accepted substances in American society. It is often seen as an essential part of celebrations, social gatherings, and even business networking. From Super Bowl commercials to wine tastings, the normalization of alcohol use makes it difficult to address its associated risk. Because of this, people may not realize why their drinking habits have escalated to problematic levels. The history of alcohol abuse. So, humans have consumed alcohol since antiquity, often integrating it into cultural rituals. Early fermented beverages were staples in civilizations such as Mesopotamia. During the 19th century, temperance movements in the US and Europe gained traction, emphasizing the dangers of alcohol and its link to moral and social decay. Prohibition sought to address these concerns but had unintended consequences, such as the rise of organized crime and black market alcohol. The late 20th century marked a turning point, with alcohol use disorder gaining recognition as a chronic medical condition. This shift led to better diagnostic tools such as the DSM and more targeted treatments. Alcohol remains a major public health challenge, accounting for significant healthcare costs and mortality rates worldwide. Today, alcohol remains one of the most commonly consumed and abused substances, with trends showing increased binge drinking and associated health risk. Some prevalence and statistics of alcohol use. So, alcohol use is deeply ingrained in our culture, making it the most widely consumed substance in the United States. Over 85% of adults report having used alcohol at some point in their lifetime. Alcohol use disorder affects nearly 14.5 million Americans, contributing to 95,000 deaths per year, making it a major public health concern. The consumption of alcohol has increased by 2.2% annually since the 1990s, suggesting a growing pattern of use and potential dependence. Additionally, 1 in 4 individuals with past year alcohol use disorder also had a comorbid substance use disorder, highlighting the overlap between alcohol misuse and other forms of addiction. Alcohol use disorder, some demographics and health disparities. So, while heavy drinking is more common among men, research suggests that women experience more severe health complications related to alcohol use, including liver damage and cardiovascular risk. Alcohol use disorder is also more prevalent in low-income and marginalized communities, often due to increased stressors, lack of healthcare access, and limited treatment availability. On a global scale, alcohol-related illnesses contribute to 3 million deaths per year, making it one of the leading causes of preventable mortality worldwide. Some of the biological and psychological risk factors for alcohol use disorder. Research suggests that genetics play a significant role in the development of alcohol use disorder. Individuals with a family history of alcohol use disorder are at a higher risk of developing dependency themselves. Mental health conditions like anxiety, depression, and PTSD are closely linked to alcohol use disorder. Many individuals use alcohol as a form of self-medication, increasing the risk of developing an addiction. Neurochemical imbalances also contribute to alcohol dependency. Alcohol consumption affects our dopamine and serotonin levels, which reinforces cravings and can make stopping alcohol use much more difficult. There's also social and environmental risk factors for alcohol use disorder. Early exposure to alcohol is a major predictor of alcohol use disorder. Studies show that those who begin drinking before age 15 are 4 times more likely to develop long-term dependency compared to those who start drinking later in life. Adverse childhood experiences also play a key role in increasing the risk of substance use disorders. Individuals with a history of trauma, neglect, or abuse may also turn to alcohol for a coping mechanism. Social influences can contribute significantly to alcohol use. In college environments and social gatherings, alcohol is often viewed as a rite of passage, leading to high-risk drinking behaviors. Economic stressors also play a role. Low-income individuals often experience higher stress levels, less access to health care, and greater exposure to alcohol in their communities. Vulnerable populations at risk for alcohol abuse. Certain populations are more vulnerable to developing alcohol use disorder due to biological, psychological, and social factors. Adolescents and young adults often engage in binge drinking due to social influences. Those with mental health conditions may use alcohol as a coping mechanism, increasing their risk of addiction. Economic stressors and lack of health care access further increase vulnerability in low-income groups. Indigenous populations also face disproportionate alcohol-related harm due to historical trauma and systemic disparities. Lastly, elderly individuals are particularly vulnerable due to interactions between alcohol and prescription medications, which can lead to severe health complications. Signs and symptoms of alcohol abuse. Identifying the signs of alcohol abuse is crucial for early intervention. Behavioral symptoms often include an increasing need for alcohol to achieve the desired effect, failed attempts to cut back, and neglecting responsibilities. Physical signs may manifest as frequent hangovers, tremors, or even withdrawal symptoms when not drinking. Psychological symptoms such as mood swings and increased anxiety also indicate problematic drinking patterns. Short-term side effects of alcohol. Short-term alcohol consumption can result in immediate but serious health consequences. Impaired judgment and slowed motor functions increase the risk of falls, car crashes, and risky behaviors. Alcohol poisoning is a major concern, especially with binge drinking, as it can suppress respiratory functions and lead to coma and death. People can also experience slurred speech, blurred vision, slow reaction times, disinhibition, and risky behaviors that could lead to unsafe sexual practices. Also lead to nausea, vomiting, and dehydration. Long-term side effects of alcohol. While some effects of alcohol use are immediate, others take years to develop. Chronic alcohol consumption severely impacts the liver, increasing the risk of cirrhosis and cancer. Heavy drinking also strains the cardiovascular system, leading to hypertension and heart failure. Long-term alcohol exposure can also cause permanent brain damage, increasing the likelihood of dementia and other neurodegenerative diseases. The potential for overdose or use as a suicide weapon. Alcohol is a leading contributor to both unintentional overdoses and intentional self-harm. It impairs judgment and lowers inhibitions, which can lead to risky behaviors, including suicide attempts. Research shows that nearly a quarter of all suicide deaths involve alcohol. Additionally, when alcohol is mixed with other depressants, it can dangerously slow respiration, increasing the likelihood of fatal overdose. Some screening and diagnostic tools for alcohol use disorder. Alcohol use disorder is diagnosed using various screening tools. One of them is the CAGE questionnaire. It's a quick 4-question assessment. You just ask if they're interested in cutting down on their alcohol, if others have been annoyed by or criticizing their drinking, they felt guilty about drinking, if they have to have a drink the first thing in the morning. There's also an audit test, which provides a more comprehensive evaluation. It assesses for alcohol consumption, dependency, and harm. The DSM-5 categorizes alcohol use disorder by severity as mild, moderate, or severe based on the symptom criteria. Some of the pharmacological treatment approaches for alcohol use disorder are naltrexone, acamprosate, and disulfiram. Naltrexone is one of the most commonly prescribed medications for alcohol use disorder. It works by blocking opioid receptors, which diminishes the reinforcing effects of alcohol and reduces cravings. Acamprosate is effective in helping individuals maintain sobriety by normalizing brain activity disrupted during alcohol withdrawal. It's typically prescribed post-detox. Disulfiram is unique in that it creates an aversive reaction when alcohol is consumed, serving as a deterrent. One of the important things, if someone's on disulfiram, they can't have any alcohol, even products with alcohol, because it creates such a violent reaction where they'll vomit. Patient adherence is crucial for effectiveness. Topiramate is an off-label option with growing evidence supporting its role in reducing alcohol cravings and consumption as well. Pharmacological intervention should be tailored to individual needs, considering comorbidities and treatment goals. Some behavioral interventions for someone suffering from alcohol use disorder could be cognitive behavioral therapy. Cognitive behavioral therapy is a cornerstone of non-pharmacological treatment for alcohol use disorder. It helps patients identify and change negative thought patterns that drive alcohol use. Another one is motivational interviewing. This is particularly useful in the early stages of treatment as it focuses on resolving ambivalence and increasing motivation for change. It also helps the provider not have as much burnout and fatigue because it's just getting the patient to see where they are in their readiness for change. Mindfulness practices are also great. They reduce stress and support emotional regulation, which is something that people use alcohol to help with. Also, support groups like AA, they can provide a sense of community and accountability, which is critical for long-term recovery. Mindfulness practices such as meditation, yoga, they've been shown to reduce cravings and improve emotional well-being. Exercise interventions also offer dual benefits for physical health and mood improvement, which supports overall recovery efforts. Some patient education. So this is very important. We should explain the risk of continued alcohol use and the benefits of sobriety. We need to emphasize that long-term alcohol abuse increases the risk of severe health conditions like liver disease, heart problems, and neurological impairments. We need to use accessible language to highlight the benefits of sobriety, including improved physical health, better mental clarity, and enhanced relationships. Referring to some studies by Christine et al. In 2022, they underlined the long-term health improvements following sustained abstinence. We also can discuss medication adherence and potential side effects. We can educate the patient on the importance of taking the prescribed medications as directed. For example, they need to take the naltrexone to reduce cravings, but missing a dose can decrease its effectiveness. We need to explain the potential side effects, such as nausea or headaches with acamprosate, and stress the importance of reporting any adverse reaction to their healthcare team. We need to emphasize the importance of avoiding triggers and developing healthy coping strategies. We can discuss how triggers such as stress or specific social settings can lead to relapse. We can suggest practical coping strategies like mindful exercises, which have been shown to support emotional regulation. We can encourage the patient to keep a journal to track triggers and develop personalized strategies. We need to provide resources such as hotlines and community support programs. We can share accessible resources such as Alcoholics Anonymous, which is AA, or local support groups to foster community and accountability. We can highlight helplines like the SAMHSA National Helpline, and online forums for immediate support. A referral and follow-up for alcohol use disorder. We can start by explaining the importance of a multidisciplinary approach to alcohol use disorder treatment. Referrals to addiction specialists provide comprehensive care through programs tailored to the severity of alcohol dependence. We can highlight the value of involving mental health providers to address co-occurring psychiatric conditions, which are very common in individuals with alcohol use disorder. We can stress the role of support groups in building a community for accountability and long-term recovery. For patients with severe withdrawal symptoms, we should emphasize the need for immediate referral to medical detox facilities to ensure safety. Our follow-up plan can be bi-weekly follow-ups. They're crucial during the initial phase of treatment so we can monitor progress and make adjustments to the care plan as needed. During these visits, we'll assess their adherence to pharmacological and non-pharmacological treatments. We can regularly monitor their liver function because alcohol misuse can cause liver damage, which may initially worsen before improving with sobriety. We can reinforce the importance of relapse prevention strategies, such as avoiding triggers and maintaining a strong support system to help sustain long-term recovery. We can encourage the patient to provide feedback on their treatment experience to improve outcomes and maintain engagement. So, in conclusion, alcohol use disorder is one of the most significant public health concerns today. Despite its legal status and social acceptance, alcohol causes immense harm to individuals and communities. The good news is alcohol use disorder is treatable. By promoting early screening, increasing access to treatment, and reducing stigma, we can help more people recover. A shift in how society views alcohol is necessary to reduce the prevalence of this disorder. It's a chronic, relapsing condition that affects millions of individuals worldwide. Finally, public health initiatives such as alcohol education campaigns and policy-driven interventions are going to be key to reducing the overall burden of alcohol misuse. By addressing alcohol use disorder from both a medical and societal standpoint, we can contribute to a healthier, more informed future. Thanks for listening to this presentation. This is my list of references. Thanks.